We're here at MemorialCare Long Beach Medical Center with Medical Director of the Adult Cardiology and Interventional Labs, Dr. David Chevelle. How are you doing today?
Real good, thank you.
So we've just heard that you've had a MitraClip procedure happening here. Tell us exactly what a MitraClip procedure is and why that's so prolific here at MemorialCare.
We started our MitraClip program approximately 5 weeks ago. We yesterday completed our 9th case. MitraClip is a non-surgical procedure used to treat patients with mitral regurgitation, which is a leaking heart valve. This is typically used in patients who are not thought to be appropriate candidates for surgery because they're typically too ill. So this is an alternative to a surgical approach.
What are some of the benefits and challenges that could arise during a procedure and thereafter?
The MitraClip procedure is done in the cardiac catheterization laboratory. Patients are under general anesthesia. They're on a breathing machine with an anesthesiologist. The procedure lasts anywhere from 30 minutes to 2 hours. The average procedure is approximately 60 minutes. The tubes that we use to do the procedure are relatively large. There's a risk of bleeding complications. There's a small risk of a stroke. The benefits of the MitraClip procedure is compared to traditional surgery, the recovery is much faster. All of our patients have recovered in a non-ICU setting, meaning just on a telemetry floor. All of our outpatients have come in for the procedure and gone home the following day. So it's an interesting procedure. It's done what I would describe as a true team approach. So we have 4 interventional cardiologists that are participating in our program here. We have 2 imaging specialists that participate in the procedures, and then we have a whole cath lab team. So it's really a true team approach to treat these patients. In addition, once they get the MitraClip procedure, specifically those that have heart failure are seen by a heart failure specialist.
I'm here with the Medical Director of the Heart Failure Program, Dr. Yoon, and his patient here, Maisha. How are you both feeling today?
We're doing wonderful. She's doing great.
Maisha, tell us, how are you feeling after your procedure that you just had yesterday with the MitraClip?
I'm doing good. I feel better. I feel a lot better than before the procedure.
Tell us a little bit as to how you were feeling prior to the procedure and why you opted for the MitraClip. Was an operation even an option?
Yeah, an operation was an option, but I have a 13-month-old, and so I would have been away from her longer, and I have minimal support right now, so it was just easier to do this. And before the procedure, I was very, very short of breath. I couldn't walk 10 feet without having to stop. So imagine that with having to take care of a baby too. So
it's been really tough and challenging. So I'm guessing, tell us a little bit as to how did the procedure go and what are you looking forward to now that you're out of it?
It went well, I think. I was asleep, but no. And to be more active because my baby is getting older and she's more active, so I have to try to keep up with her.
Well, you're laughing, which is heartwarming, and you get to go back home today?
Yes.
So, Dr. Yoon, tell us a little bit as to, because you had been working on Maisha, specifically she was your referral patient, and so once you had to make that decision of, okay, you can go forward with the MitraClip, how did that procedure go for you on your side?
It's very gratifying to have the MitraClip procedure here at the Long Beach Memorial Hospital. It's a new procedure that we can offer the community, and we're very excited that it's here. For Maisha, she had congestive heart failure with a very leaking mitral valve. So her heart function was very weak, and because of the leaking valve, that made her symptoms of shortness of breath even worse. So we did consider the option of surgery, but as she mentioned, it's just not possible with her current home situation. So to offer her the MitraClip instead, where she could have a quick procedure, be in and out of the hospital in less than 48 hours, and feel so much better, it's just so gratifying to me as her doctor, following her for a while now, just to see her feel better and to have her go home with improvement.
Okay, so tell us, how life-changing has this procedure been for you?
It's very life-changing. I'm going to know more once I get home. But I think I'll be a lot better because there's times that I couldn't do certain things with my daughter, and now I'll be able to. Of course, I'll work myself up to that, but I see it being a lot better.
Well, you're smiling, and so hopefully you will be doing much better. I'm sure you will be. Thank you so much, Maisha, and do stay well. And Dr. Yoon, thank you so much for your work.
Thank you.